must get vaccinated.
Good afternoon, all, and thank you for joining us here to talk about all things COVID. We're joined by Dr. Denise Rodgers, who is the Vice Chancellor for Interprofessional Programs at Rutgers Biomedical Health Sciences, and she's also the chair of the League for Healthy Newark, as well as the Commissioner for the Homeless for the City of Newark. So thank you, Dr. Rodgers, for joining us this afternoon. I'm going to turn it over to you to talk to us about COVID.
Thanks, Catherine. So I want to start our conversation today about just going back to basics. What is COVID-19? And COVID-19 is a novel viral infection, which means it is a disease that's caused by a virus that was never seen in humans before it emerged in end of December 2019, early January 2020 throughout the world. So no human beings had ever gotten this disease until then. And the reason that people get novel viruses is that the nature of a virus, which is a small germ that makes people sick, is that over time they mutate. And so what we believe is that a coronavirus that was in an animal host mutated over time to then become contagious to people. And that's how we got COVID-19. And because human beings have never seen COVID-19 before, it means that no one had any immunity to it. So just about everyone who is exposed to COVID gets sick from it, because there was no natural immunity developed because it was new. I should say that the name COVID comes basically from the first few letters of what it is. So coronavirus, CO, virus, VI, and then disease, D. And then it was discovered in 2019. So that's how we come up with COVID-19. The other thing I want to remind all of us is that coronaviruses themselves are not new, actually, to human beings. There are 5 common types of coronavirus that cause colds, typically in children. So most people have actually had one of those 5 or multiple of those 5 types of coronavirus, but not the COVID-19, the new one. The other thing I want to remind people of is that we have seen novel coronaviruses before. The first time was in 2003 when we saw SARS, that also actually first emerged in China. That's called SARS-CoV-1, 2003. And then in 2012, there was the emergence of another coronavirus novel infection called MERS, Middle Eastern Respiratory Syndrome. I should say that MERS in 2012 never got the same kind of traction that we see with COVID-19. Thank goodness, because the fatality rate for MERS is about 35%, and the fatality rate for SARS, the 2003 initial COVID variant, is about 3%, which compares to about 1.5% mortality rate for COVID-19. So again, this is a germ. We are all of us familiar with viruses. Viruses cause common colds. Viruses cause HIV. Viruses cause herpes. Human papilloma viruses cause cervical cancer. And so there's nothing new about the notion of a virus. It's just this particular virus we've never seen before.
So, Dr. Rodgers, why should I get the vaccine if I can still get COVID?
Well, the quick answer is so you don't die. So people who are unvaccinated are about 5 times more likely to get infected with COVID than vaccinated people. but people who are unvaccinated are 13 times more likely to die. So while this vaccine, again, similar to many other types of vaccines, specifically we think about flu vaccine, for example, doesn't 100% protect you from getting sick, it's incredibly effective for the vast majority of people in preventing you from being hospitalized and dying from COVID.
So if I've already had COVID, why should I get vaccinated? The question here is, don't I already have natural immunity to COVID?
Yeah, so it's estimated that you probably do. And the most recent research, sort of following people who've had COVID, looking at their natural immunity, is it lasts at least 3 months. And so we don't actually recommend that people who've had COVID get the vaccine for at least 3 months, 90 days afterwards. But the research has also shown us that the immunity that you get from the vaccine is much more effective and long lasting than the immunity that you get from just getting the disease itself.
And is it true that researchers rushed the development of the vaccine so its effectiveness and safety can't be trusted?
So it's not true at all. This vaccine, the downside to the language that was used in the previous administration of Operation Warp Speed lends people to think, oh my goodness, this thing was rushed, it wasn't well studied. Part of the reason that I talked about SARS-CoV-1 from 2003 and MERS in particular is that when SARS-CoV-1 emerged in 2003, research started on developing a coronavirus vaccine. That research actually went into higher gear in 2012 with MERS because the mortality rate was so much higher. As a matter of fact, there was a MERS vaccine that was brought in a limited way onto the market in 2019. And so from at least 2004 or so, scientists were beginning to work on the development of vaccines against coronaviruses. The second thing to remember is that the mRNA technology has been also looked at for many years, particularly looking at the development of a flu vaccine, an mRNA flu vaccine. And there's been some looking at mRNA technologies as treatments for cancers. The rushed part of this actually happens when not only our federal government, but governments around the world poured in millions and millions of dollars to really take that research to the next level. So the foundation for this research absolutely has been going on for at least a decade. And what we know, though, is when you pour in more money, you can get more scientists working on this, more time. And indeed, we did get these vaccines in a relatively short time compared to the development of most vaccines. But it also didn't skip the steps. And so all of the FDA approval steps that vaccines go through as they're developed were completed with this one.
You know, one of the questions that we get over and over and over again from our grantees and people in the community, and again, you know, in national media is, does the vaccine cause infertility?
Yeah.
And, you know, piggybacking off of that, does it cause issues with women who may be pregnant or breastfeeding?
Yeah, I'm really fascinated by this particular issue because we actually have no evidence of any vaccines historically that have ever caused issues with infertility. And quite frankly, from a scientific standpoint, most of us on the science side can't think of a mechanism by which this would happen anyway. I mean, this is sort of one of these just complete lies, and I don't know a better word, that has just taken off and been spread widely. There is absolutely no evidence that these vaccines affect fertility at all, either in men or women. Um, we know that some viral infections actually can affect fertility. So, for example, some men, when they get mumps, can get infertility problems because of the virus itself. But we don't have any evidence that vaccines do this. In terms of pregnancy in particular, the data is increasingly clear that there's no evidence of danger to the developing fetus or baby from the vaccine itself. But there is significant, actually, risk to pregnant women and their babies from getting COVID. So we know that disproportionately more women die from COVID during pregnancy. And we also know that the rate of stillbirth is increased in women who deliver who've had COVID. And so we know that there's some significant risks on that side. Lastly, let me just address breastfeeding for a second. So the good news about breastfeeding is that mothers are able to give their infants the antibodies through breast milk. So the sort of mechanism that this happens doesn't mean that in any way the vaccine itself is transferred from the mother to the baby. It means, though, that those great antibodies that the mother has developed against COVID are transferred and then protect the baby as well. It's almost like the baby gets the benefit of getting the antibodies without having to get the shot. We think, however, over time, those antibodies will also wane, as they typically do in babies. And so we do think infants at some point will probably need to get vaccinated as well.
You know, speaking of that, the other question that we have and that we're getting now more frequently, of course, because we have more approval of younger children being vaccinated, is why should I get my child vaccinated? You will remember early on the previous administration saying that, you know, this doesn't really affect kids. Kids don't get that sick. Talk to us about why that's important.
Well, I think there are several reasons. One of the things that we learned actually, and we learned this even more clearly with the Delta variant, quite frankly, is that actually a subset of kids do get sick. They certainly don't get sick at the same rate that adults get sick. They certainly don't die at the same rate that adults die, but a proportion of children do die from COVID. The other reason to get children vaccinated is there is a complication from COVID in children called multisystem inflammatory syndrome. Relatively rare, but can be very serious in children, results in hospitalizations. And so overall, we really do want to protect our children from those possible risks. But the other thing is the more people in society who are vaccinated, both children and adults, the less opportunity there is for the development of more and more variants, some of which could cause tremendous problems. And so by getting children vaccinated, we both protect them as well as protecting larger society. And perhaps actually even more importantly, we're able to protect a subset of children who they themselves are vulnerable because of underlying illnesses to having very bad things happen to them if they were to get COVID.
So let's shift now to some more technical questions around the vaccine. One of the questions that we've gotten is, if I received one type of vaccine for dose 1, can I get a different type of vaccine for dose 2, especially for some of our residents who may have gotten the AstraZeneca vaccine in a different country?
So the general recommendation right now is that short of boosters, and I'm sure we'll get to boosters in a minute, that in general is probably best to get the same second dose that you got from the first dose. So if you got Moderna, get the Moderna second dose. If you got Pfizer, get the Pfizer second dose. AstraZeneca, on the other hand, isn't here. And so we strongly urge people to get a second dose that is one of the mRNA vaccines, because it appears that mixing the mRNA vaccines with a non-mRNA vaccine like AstraZeneca may give even better protection for people. That said, we are not recommending, and I want to be clear, we are not recommending that if you got your first dose of Moderna, that you get your second dose being J&J. There have not really been any studies of that. But it does appear that it's safe to mix and match. It also appears that, for example, if you got a first dose of Moderna and you show up and there's no Moderna available for your second dose, it's probably quite safe for you to get Pfizer as your second dose. So having the two mRNA vaccines is probably fine. We are recommending, of course, now, as you know, that everyone get a second J&J dose. So initially it was touted as being the one dose solution. Clearly Delta showed us that it doesn't work quite as well as we had hoped. And so again, with J&J, we're recommending that people either get a second J&J dose, or there's some evidence that you may do even a little better if you get your second dose being Moderna or Pfizer.
So you reference boosters. What is a booster shot, and why do we need one?
Yeah, I mean, the easy way to think about boosters is to understand that immunity diminishes over time, and part of the issue is it diminishes over time in people differently. And so we have some evidence that if you're older, your immunity may diminish sooner than if you're very young. But to be on the safe side, the studies seem to indicate that after about 6 months, immunity was low enough in a broad range of people that it seemed to make sense to give a booster. And the good news is that the studies clearly indicate that that booster does exactly what we hope it would do, which is it really turns that immune system back on and gives significantly added protection against COVID.
And the follow-up question to that is, do I need more than one booster shot? That's the first part. And the second part, again, going back to this idea of mixing them, can I mix them? So if I need more than one booster shot, do I get one Moderna and one Pfizer, or one J&J and one Moderna?
Yeah, so there's no evidence right now that you should get another booster shot. Remember, Moderna and Pfizer are 2-dose vaccines, right? Moderna being Pfizer being 3 weeks after the first dose, Moderna being 4 weeks. Doesn't matter if both of them are given 4 weeks after whatever, but that second shot is not a booster. So the booster is given 6 months after you complete the 2-dose regimen. And again, there's really not a lot of evidence that getting a different booster makes that much difference. And so just like my earlier analogy, if you go to get your booster and you got Moderna for your first 2 doses and they are out of Moderna that day or they don't have it, then it's fine to get Pfizer. So I don't know that people, aside potentially from people who got J&J, it's not clear to me that people should actively seek to mix and match. There probably is some evidence, as I mentioned, that getting an mRNA plus the J&J vaccine actually may give you very good protection.
So, of course, with all things COVID, things are happening, changing rapidly. We have another variant now. And so the next sort of question, which may or may not be controversial to some people, is, should I continue to wear a mask if I've been vaccinated? And should I continue to wear a mask with other vaccinated people?
Yeah. My recommendation is whenever you're indoors with a number of people who are not in your household, you should wear a mask. Um, for people like going to the grocery store, going Christmas shopping, or absolutely wear a mask. First of all, you don't know the vaccine status of many of the people around you. But secondly, as I said earlier, the vaccines are really, 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 really good at preventing you from being hospitalized and dying. They are less good at preventing you from getting COVID, quite frankly. And so, in order to protect yourself from getting COVID, and equally in order to prevent yourself from giving COVID to someone else in case you have an asymptomatic case of COVID, I absolutely recommend wearing a mask. And now, with the advent of Omicron, people definitely should increase their mask wearing significantly.
And just, the follow-up question to that is also, should we continue to social distance?
Yeah, we should. To some extent, what Omicron reminded us of is viruses are going to act like viruses do, which is they're going to mutate. And when they mutate, they're going to behave differently than the variant of the virus that we saw before. I mean, Delta, quite frankly, was that first wake-up call. It's important for us to always do the basics. So it's important for us to wear a mask, to do hand washing. If you don't have soap and water, use hand sanitizer, but also to do social distancing as appropriate to prevent the spread of COVID.
Okay.
And can I say that nobody wants to hear what I just said, in part because for most of us, we want life to be fair. And in a fair life, I would do the right thing. I would get my vaccine. I would have protected myself. And now I should be able to just go back to life as normal. And life isn't fair that way, in part because we can't control some fundamental aspects of Mother Nature. I mean, a virus is going to behave like a virus behaves. And therefore, we need to take on those extra protections to care for ourselves. I think the only other thing I want to add in the context of this conversation is the other part of life that is not fair is that COVID, like many, many other things in life, disproportionately impacts Black and Brown communities. The infection rates and hospitalization rates for COVID in African Americans and Latinx communities in New Jersey is significantly higher when looked at an age-adjusted basis when compared to whites and Asians. And the death rate for African Americans is significantly greater than all other groups from COVID when looked at again from an age-adjusted basis in the state of New Jersey. And one of the unfortunate aspects of what we are living through is it is my perception that there are those who specifically target Black and Brown communities to spread misinformation, which makes it even more important that people learn to go to reputable sources, to find people that they can trust who are knowledgeable from whom to get the information. Because, there are people who will try to deny the reality of what I just said. And yet, in the United States today, an African American is 40% more likely to know someone who has died from COVID compared to whites who are 25%. So 1 in 4, basically, whites know someone who's died from COVID, compared to 4 in 10 or 2 in 5 African Americans. This is our reality. We just need to look around us. We need to talk to people and understand how devastating this disease can be for some.
Thank you, and thank you for sharing that. Now we're actually going to pivot towards some live questions that we've gotten while you were talking and answering all of our other questions. So for that, we're going to bring the United Way Director of Health, Adobe Ndupu, who's going to come and share with you some of those questions. Thank you.
Thank you so much for having me on, Catherine. And thank you so much, Dr. Rodgers, especially your words around continuing to mask up and practice social distancing and washing our hands. I think that's a very strong message, despite vaccine status. So we're going to get into some live questions from audience, especially, and we've gotten a lot of questions, especially around the variants and what it means and what to expect around that. So my first question, and you kind of mentioned variants throughout your previous answers, is what exactly is the COVID-19 variants?
Well, a COVID-19 variant is, as I described, it's a mutation in the virus that sometimes can be meaningless. So viruses are mutating all of the time. The problem is that the viruses that mutate in bad ways are the ones that end up impacting us. So again, the first mutation was the mutation that coronavirus was in some animal host, mutated, and then figured out how to infect humans. It's not that it's cognizant, don't get me wrong, it actually doesn't figure it out. It's just that it mutates so that it becomes, so that humans are then susceptible to it. And so as we have more circulating virus in human beings, it continues to mutate, and that's how we got the Delta variant. And there have been actually a number of other mutations that we've seen, but none of them have sort of caused widespread illness, similar to what Delta variant has done. And now we have Omicron. And I will have a big disclaimer saying there's a lot we don't know about Omicron. We've only talked about Omicron for 2 weeks. And so there are many, many, many answers that we are yet to discover about Omicron. What you'll read in the press is that this particular variant has more mutations. It has sort of 30 mutations of the virus itself, which can mean that it is more contagious, which it appears right now. It may be actually Omicron more contagious than even the Delta variant. It doesn't, however, appear, and again, 2 weeks. And so you have to understand there's still much we don't know. But in the 2 weeks, it doesn't appear that it's necessarily more deadly than the other variants. But this is what viruses do. And I think for most people, the way to relate to a viral variant is understanding that's why you have to get a new flu shot every year. Because from 1 year to the next, the flu virus decides that it's going to change, and therefore the protection that you got with that last flu vaccine doesn't last to the next flu season.
Great point. And then I know you mentioned, this is a very new variant, and we're still learning so many things about it. But do you anticipate them being that there's a particular group of people, maybe individual children or the elderly, who may be more susceptible to this new variant than previous COVID-19 variants?
So this is where it gets really difficult to actually know if the experience in one country is going to be similar to another country. Because in South Africa, there's actually been a substantial increase in Omicron cases in children. Again, it doesn't appear that there's been a higher mortality rate in children, but there's definitely been an increase in Omicron in children. We haven't seen that in the United States, but it's 2 weeks, so we have no idea. But that's also why I am strongly urging everyone, wear your masks, social distance, wash your hands, and get the vaccine.
Absolutely. And then another final question from the audience was, will boosters, and you kind of mentioned this with the flu shot, and the importance of getting your flu shot every year, but will the boosters be sufficient enough for this variant? Like, let's say they got a booster shot a little earlier in the year, and now we're coming into the fall, winter months, and we get this new variant on our hands. Would that be sufficient, or will we need another booster shot in a few months?
So we don't know. That's the most dangerous thing that I could possibly do is to tell you I know something that we don't know and that I don't know. In general, overall, though, the way the COVID vaccines seem to work is right now it looks like, regardless of Omicron variant or not, it may be a type of vaccine that we need to get every year, similar to what we need to get with the flu vaccine, because immunity will wane over time.
Great. Thank you for that. And so as we wrap up the audience segment of the Q&A, is there anything that you would like to just emphasize or really drive home as we kind of wrap up this live?
Yeah, I mean, I think the thing that I really want to emphasize is actually the words of Maya Angelou, who says that courage is probably the most important virtue, because without courage, one cannot practice any other virtue with consistency. And for a subset of people, it will take courage to get vaccinated. There's so much misinformation out there. There are so many things that you hear on social media, and quite frankly, even some of what should be reputable TV channels, but I don't think are, that it will take a leap of faith to say, I am going to trust enough in science to do what all of the data suggests is the best thing, not only for my own health, but for the health of my children, the health of my parents, the health of my partners, the health of my neighbors. I am humbled to some extent by the level of fear that people have. And what's interesting? For a subset of people, and we don't talk about this enough, I don't think, for a subset of people are just afraid to get the shot. Many, many people sort of were traumatized as children when they had to get their immunizations. And so they carry around kind of, it's almost like PTSD with the thought of having to get an injection. And we need to have compassion for people who have that kind of fear. And we need to urge them to engage in strategies that will allow them to overcome that fear in order to be able to get this vaccine. I think the only other thing that I want to say is we also need to tap into what is potentially our faith-based philosophies or our life-based philosophies that talk about, I am my brother's, sister's keeper, that it is my obligation to care for my neighbor, and that one of the most important ways we do that is through public health. And it's hard. I mean, I think in theory, we say these words so easily, but in theory, it is very difficult at times to do that, particularly when we're just ready for all of this to be done.
Yes.
And it's not done yet.
Absolutely true. Thank you so much, Dr. Rodgers. Those incredibly, powerful words, about courage and compassion, and I couldn't agree more. So we really thank you for that. So now we're going to go back to Catherine to close us out for some closing remarks.
Hi, all. I just want to say thank you again to Dr. Rodgers for taking the time to answer all of our questions. She's been advising us since the start of COVID on all things COVID and of course with the vaccine. So again, a huge thank you to her for taking the time out to do this. I also want to let folks know that if you are looking to get vaccinated, you can go to the newarkvaccinenow.org website. That will actually link you to the Believe in a Healthy Newark website. You can simply type in your address and find out where you can get vaccine locally. And if you've been vaccinated, continue to talk to your family and friends about why that's important. Continue to wear your mask, continue to social distance. And as I always hear Dr. Rodgers say, make sure that you get your flu shot this year and stay well. And thank you all again for joining us. And one more thing, just remember to continue to get tested as well so that we can continue to stay safe. Thanks, everybody.